Welcome back to Dr. Ryan, the channel where we break down your body's signals and turn them into practical, science-based insights that help you take better care of your long-term health. Today, we're talking about something incredibly important but often overlooked: the subtle ways your body tells you it's missing essential nutrients. Most people imagine nutrient deficiencies as dramatic events, fainting, extreme fatigue, or serious medical problems. But in reality, your body whispers long before it ever screams. These whispers show up on your skin, your nails, your mood, your digestion, your energy levels, and even in the cravings that hit you at night. To understand these body signals, it's important to first understand why deficiencies happen in the modern world, even when food seems abundant. A major reason is that many people struggle with poor absorption. When the stomach doesn't produce enough acid, when bile flow from the gallbladder slows, or when the gut lining becomes irritated, nutrients simply don't get absorbed effectively. This is especially true for fat-soluble vitamins like A, D, E, and K. Another reason is that modern soils are depleted. Food today may look perfect on the surface: shiny apples, flawless lettuce, enormous tomatoes, but appearance doesn't guarantee nutrient density. If you notice that produce today often tastes bland, that's not your imagination. Taste is one of the body's natural ways of detecting nutrient richness. And finally, we cannot ignore the role of refined foods and sugar. When sugar enters the body, it burns through minerals and vitamins rapidly, especially zinc, vitamin C, B vitamins, magnesium, and potassium. Sugar is like a thief that snakes in, steals nutritional reserves while providing nothing in return. With that foundation in mind, let's explore how your body communicates nutrient deficiencies through everyday symptoms. One of the earliest signs people notice is small white spots on the fingernails. Many assume it's low zinc, but surprisingly, the underlying cause is often too much sugar, which weakens zinc levels. If you are someone with naturally oily skin that feels greasy no matter how often you wash it, that can also hint at low zinc, because zinc helps regulate oil glands and maintain hormonal balance. Cracks at the corners of the mouth or cracked heels are another common sign, often tied to low levels of B vitamins such as B2 and B3. These vitamins play a huge role in skin integrity and the health of your mucous membranes. Many people also notice persistent flaky skin around the nose, eyebrows, or forehead. This chalky, dry texture frequently reflects low omega-3 fatty acids. Omega-3s help maintain the fluidity and moisture of skin cells, and most people consume far more omega-6 from processed foods, creating an imbalance. Another subtle signal appears in the eyes: a yellow tint on the whites. This can point toward issues with bile flow from the liver or gallbladder. When bile doesn't move properly, certain pigments from red blood cell breakdown can accumulate, affecting the eyes. Sometimes the signals appear as sensations rather than visible changes. A dry, persistent cough with no illness attached can suggest that your body needs more calcium. Calcium plays a role in the contraction and relaxation of muscles, including the small muscles in the throat. If your gums bleed easily when brushing, vitamin C is often the missing piece. Vitamin C strengthens capillaries and supports collagen. People with high sugar intake often experience this problem because sugar competes with vitamin C inside the cells. Another overlooked sign is difficulty seeing at night. If you find yourself straining to drive or walk in low light, it may suggest that you need more vitamin A, specifically retinol, the active form found in animal foods like egg yolks, fish, and liver. Beta-carotene from plants doesn't always convert efficiently. Chapped lips that split easily also point toward low B2, especially if you eat a lot of refined grains stripped of their natural nutrients. Your feet and ankles can also reveal hidden deficiencies. Swelling or puffy ankles, especially if pressing a finger into the skin leaves a dent, can signal an imbalance between sodium and potassium, typically too much sodium combined with low potassium. Iron deficiency shows up in an unusual way: cravings for ice. Many people who feel compelled to chew on ice actually have low iron levels, especially children and menstruating women. Some people experience a kind of chest tightness or discomfort, not necessarily tied to heart disease. Low vitamin E may play a role because this antioxidant protects the inner lining of blood vessels from oxidative stress. Muscle cramps, especially cramps in the legs or feet that appear at night, are one of the clearest signs of low magnesium. Magnesium is at the center of chlorophyll molecules, which means leafy greens are the natural solution. Emotional signs can appear too. If you often feel mentally restless, overwhelmed, or irritable for no obvious reason, your nervous system may need more vitamin B1. Even small amounts of nutritional yeast can offer quick support. Some people experience breathing tightness or asthma-like feelings that improve with vitamin D, especially in the winter when sunlight is limited. If the outer third of your eyebrows is thinning or disappearing, that can indicate the thyroid is under stress and potentially lacking iodine. Another surprising signal is discomfort in the right shoulder or upper back. This area is connected neurologically to the gallbladder, so tension here may reflect issues with bile flow or fat digestion. Even your dreams can tell you something. Recurring nightmares or unusually vivid dreams may reflect low B1, because parts of the brain that process fear rely heavily on thiamine. Cravings for salty foods late at night can mean your body needs more sodium, but in a proper balance with potassium. Lower back stiffness that lingers may come from low vitamin D, especially during darker seasons. And perhaps the most surprising sign of all is craving dirt or clay, a behavior sometimes found in children or pregnant women with iron deficiency. Nutrient deficiencies can even affect intimate health. Low zinc can influence testosterone balance and lead to performance challenges in men. Finally, mood changes such as persistent sadness or low energy may connect to low vitamin D, a vitamin that plays important roles in brain chemistry and emotional balance. The key message here is that your body is always trying to communicate with you. These signs are not diagnoses, but they are reminders that your body needs support. Modern lifestyles, high stress, processed foods, poor sleep, and reduced sun exposure all drain nutrients faster than most people realize. By paying attention to these subtle clues, you can make simple changes to your diet, increase nutrient-rich whole foods, and support your body before problems escalate. If you found this breakdown helpful and want more insights like these, be sure to subscribe to Dr. Bather, Ryan, turn on notification, and stay tuned for more videos that help you understand your health in a practical, empowering way. Take care of your body, listen to its signals, and I'll see you in the next video.